Good morning, everybody, and welcome to the Gresham Area Chamber of Commerce Business and Leaders Luncheon. My name is Asha Aiello. I'm the director of the Work Ready program for the Gresham Area Chamber of Commerce. I'm here today hosting in lieu of Lynn, who is off enjoying a very well-earned vacation. So she asked me to go ahead and host for her with the amazing Dr. Perera and Mr. Jordan Ely. First off, we'll just give everybody a second or two to pop on in. I know loading into a webinar is a little tiny bit different in Zoom than it is loading into a call, so we'll just give everyone a couple of minutes. In that, I would like a chance to thank our sponsors. We have 3 presenting sponsors of our Business and Leaders Luncheons. Hopefully, with everything coming, we can eventually all do this in person again very soon. Presenting sponsor, Columbia Bank, PGE, and Boeing. Stakeholder sponsor, Gresham-Barlow School District, and our media sponsor, MetroEast Community Media. We want to thank them for being a part of that, for allowing this to happen, and we're really excited to hear from Dr. Perera and Mr. Ely. A little bit about Dr. Perera. She was selected in May of 2017 to serve as a superintendent of schools beginning July 1st. She's the former National Director of Urban Markets Division with McGraw-Hill Education. Prior to her work with McGraw-Hill, she served as superintendent of the Isle of Wight County Schools in Smithfield, Virginia for 4 years. During that time, she received the National Association of School Superintendents 2015 Superintendent of the Year Award. Dr. Perera's extensive experience as an educator includes a classroom teacher, middle school principal, and area regional superintendent of the Houston Independent School District, which serves more than 200,000 students. Mr. Jordan Ely is the Chief Financial Officer of Gresham-Barlow School District. He comes to us from Ashland, Oregon, and has served there in a similar capacity. I will let him tell you more about himself when he gets into his portion, but for this point, I will turn it over to you, Dr. Perera.
Thank you, Asha. Just wanted to make sure my mic was on. Good morning, everyone. Or actually, well, yeah, it's still morning. Good morning, everyone. And thanks for allowing us to be here with you today to learn a little bit more about what's happening in schools and athletics, operations, and bond work. Several months into this pandemic and school closures, like so many of you, families and parents across the country, each of us have all grown a little overwhelmed by the numerous unknown challenges we have faced. Our response this summer and fall was to begin crafting a longer term plan, if you will, and at the same time, we had to deal with the daily reality of the pandemic. We committed ourselves to making sure that our students had devices, food, and access to internet so that they can continue to participate in the learning. And we also had to continue to envision and tweak a different way of teaching and learning and leading actually for the work. And I think some of you who are parents also had to parent a little differently as well throughout this pandemic. And while there was no playbook, if you will, we attempted to build our own and continuously prioritize our own blueprints. But I often ask my team, how do you prioritize when everything is a priority, right? I've been grateful and appreciative of the bold and courageous leadership that our board of directors have shown. They who have been put in positions to be medical experts when, in fact, they are not. And also my leadership team who are charged with dealing with, and Jordan's going to share a little bit of that today, who are dealing with the safety and health and guidance as we pivoted into this new instructional model and as things continue to change almost daily. Our hope is that today when we're done that you're able to see that there's been a lot of work and potential of implementing a safe return to school. And again, Jordan will highlight that information. I will close with this thought. The appreciation and pride I have in knowing that these last 10, 11, 12 months, our students, our families, our community leaders, and our educators, and this community as a whole, it proves that we could do hard things. This is hard, and it's still happening, but it's hard. I'm seeing a little bit of light. But during which I will commit to each of you that we will continue to move as fast as we can, but as slow as we must. And with that, I'm going to review the roadmap that we're going to take today. We're going to talk about the return to learn operations, the reopening of athletics, and Jordan also wants to highlight some of the bond updates. And with that, I'll turn it over to my colleague and CFO for Gresham-Barlow, Jordan Ely.
Thank you, Dr. Perera. Hi, everyone. I'm happy to be here with you today. I will ask that you excuse my voice. It's not typically a great voice to begin with, but I'm recovering from a strep infection, and so sound even less great. But I will try to fly through this stuff in an efficient manner, but uh, in a way that hopefully we can convey some meaningful information. My updates today are going to focus more on the operational aspect of our business. If we have parents on the line with us today, we have communicated a lot of what the student experience looks like, things of that nature, through some other channels at board meetings and town halls and things like that. Oh, excuse me. But I just wanted to give a really brief overview of how our operations teams have prepared to bring students back into our buildings, what our athletic operations look like, and then the bulk of this presentation will actually be an update on our bond, because despite a pandemic, we had carried forward on that work and have a lot to update you on since the last time we updated this group. So we are following the ODE, Ready School Safe Learners guidance. There's about 160 rules in that guidance that have been changed, modified, added, subtracted over time as our public health officials understand this pandemic more. I was on a call with Multnomah County Health and OHA just last week, and I asked the question, what can I tell our community when I get asked the question, why is it that when we shut down schools, case rates were 4 times lower than they are now, but now public health officials think it's safe to come back to school? And what they said is that we understand the virus better now. When it first happened, this was a brand new thing that nobody had seen before, and so public health officials really didn't know what we needed to do. The other thing is that had those measures worked at the very beginning, the hope was that we would have contained the virus within a few weeks. That obviously didn't happen, and now public health officials are moving their guidance away from trying to control a pandemic to mitigating risk within an endemic. So we are following that guidance, and what that tells us is that we need to have enhanced sanitization protocols for all of our buses and buildings. Classrooms need to have at least 6 feet between each student in any direction, and so that's the 36 square foot bubble that you hear us talk about in some of our presentations. It also means that we have to have a teaching corridor at the front of the classroom. And so the first 3 feet of the classroom is reserved for the teacher to be able to move along their teaching wall. And then there's 6 feet from that point to the first student desks. And what that means is that in most of our classrooms, the capacity has been reduced to 12 to 13 students, whereas in the past, it would have been 25 to 35 students. All of our schools have been assessed for airflow. Actually, because of the bond, most of our facilities have new HVAC systems, and the systems themselves provide all of the airflow that we need. Sorry, I keep hitting buttons here. There are 2 exceptions at West Orient and East Orient, and our facilities team has taken other mitigating measures there to adjust the systems that they have in place, and then also bring in additional units as necessary. So every one of our buildings has adequate airflow to meet the guidance that we were given. And we've also added air filtration to all of our what we're calling our care rooms, and that's where any students or staff who don't meet the screening requirements at the beginning of the day or sometime during the day will go to an isolated room sealed off from the rest of the building, and that has air filtration in it. We have a lot of PPE purchased and on site. We have a stockpile at our district facilities warehouse, and then we have some distributed out to the sites. The thing that I wanted to impress upon the group today, though, when we think about the PPE situation, when we talk about disposable masks, for example, we are serving 11,000 students, and we expect, based on surveys that we've seen, that about 2,500 to 2,600 will be on campus each day when we return to hybrid. And so if we have to replace those masks every single day, 200,000 masks only last us less than 100 days. So we do have a lot of PPE on hand. We also have the cloth face coverings that we'll be issuing to all students and staff, and we have a system for washing those masks. Our custodial staff will use mesh bags to collect those masks, wash them overnight, and then reissue the next time that those students return to the building. We have hand sanitizer posted throughout all of our buildings. We have these little pedestal stands. And so we've got signs and visual reminders, and then we've got meal delivery plans in place. What that means is that our nutrition services team is actually going to be bringing meals to the classrooms. They'll post the meals up right outside the door. The teacher will then go grab the cart and bring it into the classroom. And the teacher will spray each student's desk with sanitizing spray. The students will be trained on how to then wipe that spray after letting it sit for 1 minute. Of course, this is a different cleaning material than what we would normally use. What we normally use needs to rest for quite some time before student contact is safe. This cleaner, of course, is safe for students. And so the students will be trained to wipe that off, and then the teacher will bring one student to the front of the class to grab their meal at a time to maintain that social distancing. So the main idea here is that things are going to look a lot different when we reopen, and certainly not ideal. And that is not the picture that I'm trying to paint today, but what I hope that you all walk away from this understanding is that your district operations team has taken this very seriously. We've worked with local and state health officials to develop plans and get our buildings ready in a way that we have seen other school districts effectively open safely and limit spread. And this is why you're seeing research nationally that says that schools aren't super spreaders. It's because of these types of protocols. And so we are ready with these protocols in place. As far as athletics, the athletic year was reorganized into 4 seasons this school year. Prior to winter break, we were allowed to open up conditioning only practices. Of course, Multnomah and Clackamas counties have led the state in case rates and total cases throughout this entire pandemic on most weeks. Sometimes Washington County or Marion County has taken the crown, but most weeks it's been Multnomah and Clackamas. And so even when, the school district I grew up in, for example, Grants Pass School District, they've been able to do more stuff than we have up here. But we at least were able to get kids in for conditioning starting before winter break. On February 8th, we were allowed to start 7-on-7 football practices, just practices, no competition. And on February 22nd, at that point, we can decide to go to a basically 11-on-11 touch football. I don't think our athletic directors and football coaches have decided which way to go on that just yet. I think it'll have a lot to do with what the rest of the Mount Hood Conference does. But we can also start volleyball, soccer, and cross-country practices on February 22nd. We cannot do any of the full contact sports and competitions. Even though competitions begin on March 1st, we have to be in limited in-person instruction before we can do any of the full contact sports. So we'll still be able to do cross-country and soccer and things like that, even though we haven't started limited in person. But we will have to wait until we've started limited in person before we can do any of the full contact competition stuff. So here's some pictures of our. Yeah,
we should start phasing in like the last week of February. So hopefully by that time we'll have enough limited in-person up and going by then.
Excellent. Thank you, Dr. Perera. So again, not ideal. You can see our students are out there wearing masks, our student athletes. I haven't played organized sports since high school, but I can't imagine that that's a great experience, but the kids have been great about it. And that's really been the experience of school districts across the country, is that kids have really risen to the challenge of this pandemic. And so certainly some great life skills coming out of this if we can try to put a silver lining on it. So the rest of my presentation will be about the bond. There's a lot of information here, dense information. Some of it may be repetitive, some of it not. I've actually not given an update on the bond to this group, so I tried not to duplicate too much. I met with Mike Schofield a couple of weeks ago to talk about pertinent points that I should hit with this group, and so hopefully this will be relevant information to you. But we'll start back at the beginning. In 2016, the community gave us permission to issue just over $291 million in debt, which we have now done. The debt has been structured to ensure payoff over a 20-year period, which began at the first issuance. And I'll talk about that more in a minute here. The district has issued 2 rounds of bonds. The reason for the split was to ensure that we could meet the federal spend down requirements. To date, the district has expended enough from each issue to satisfy those requirements, so there is no longer a clock on the spend down of our remaining funds. Favorable market conditions in both issues resulted in total bond premium in excess of $33 million. The district also received more than $9 million in interest on investments and $8 million in state grants, resulting in total available resources of nearly $343 million, more than $50 million more than the debt incurred by the community. The debt structure looks like this. Obviously, when we issued this debt in 2017, in the 2018 fiscal year is when we started paying on that debt. And so that's where you saw that big spike that brought in the debt service on that 2017 issue. We then issued again in 2019, and that brought in the rest of it. This is a projection. The district worked with Piper Jaffray to issue these bonds and structure the debt in a way that intends to keep property tax rates relatively stable over the next 20 years. For the first 2 years of repayment, the needed levy rate has been slightly lower than expected. Due to the way that Oregon's property tax code works, this is actually a solid indicator that the target rate will be met or beat for the duration of the repayment schedule, though that cannot be guaranteed, of course. The levy rate is calculated by the county assessor's office. The district just provides the total debt service required for each year to those offices, and then they determine the millage rate based on their forecasts for the fiscal year. Excuse me. After passage of the bond, the pre-bond plan was formalized into what we call the bond promise. These represent the scopes of work the board and administration felt constituted the spirit of the voters. Green shading indicates a promised scope of work, and each white X is a delivered promise. As of this report, the district has completed 90 promises and has 16 remaining. The first 90 included the 4 major projects: East Gresham Elementary School, North Gresham Elementary School, Gresham High, and Barlow High. We anticipate completing the final promises during the 2021 calendar year, and cost estimates received from our project managers indicate that we will be able to finish all of these projects on time and within budget. When the district conducted its planning for the program, nearly $600 million in costs were identified. Recognizing the substantial burden that would place on taxpayers in one fell swoop, the ask was reduced to $291 million. On the first slide, you saw that we gained an additional $50 million in resources for this program. With these additional resources, some of the items removed from that initial plan were able to be added back in. In addition to the major items listed on the prior slide, nearly every school has had value-added scope added. This has been possible through the additional resources already discussed, as well as sound project management. Most of this work was done pre-COVID in an economic climate that was very challenging for many school districts due to scarce contractor availability. Both high schools were completed during the pandemic, which presented challenges of its own. The district purchased many materials early to avoid supply chain interruptions, and we were able to complete the jobs on time. GHS actually ended up being 1 week late, but for a project that size, I'm still calling that a win. So those are the major updates that I have for the group on the bond. We have, up to this point, spent about $330 million. And so we really are down to the very final stretch of this bond work. And so I have some pictures to share with you. And as I scroll through these pictures, I'm prepared to take questions if the group has any.
We really have ended up with some very beautiful facilities, and I'm excited for when we do have an opportunity to bring our kids back, that they are able to see the progress, especially at the two high schools. I'm excited for them to return.
Yeah, I believe it was the first AM I met, or actually first time I met you, Dr. Perera, was at East Gresham during our AM back when we could still do things in person.
True.
I particularly enjoyed working across the street, watching Gresham High School take shape day after day.
It's a gorgeous facility.
Very much so. As Jordan runs through these photos, if there are any questions, we haven't been typically taking questions unless Lynn specifically had some on these business and leaders luncheons. So I will say, if you have any questions, either put them in the chat and I will ensure that they get to Dr. Perera and Jordan, or you're welcome to reach out to Angela Trombitas or myself, Asha Aiello, at the Chamber, and we will get those questions to Dr. Perera and Jordan. So I know there's good number of attendees. Thank you for those pictures, Jordan. That was the facilities are absolutely gorgeous.
Again, I'd like to have the kids back.
I'll bet they're excited to be back. I know the Pathways programs, which had situations where they developed a bench or the students got to develop something for themselves and have at some of these schools, I think will be the point of pride there is so strong that to come back to these beautiful facilities and be able to get back to something that resembles normal. See, it looks like I have one Q&A. I have one question from Jeremy Buck. He says, any projected dates of in-person learning? He says, my son will be entering kindergarten at East Gresham, and we are wondering what to expect.
Yes, I was actually in the process of typing a response to Jeremy, and that I want to say thank you to this community for the patience that we've all had to do or extend throughout this, as well as the grace as we move forward. We are looking to move into in-person learning or limited in-person learning beginning probably the last week of February, going into the first week of March. And we will have a kind of a rolling start for our grade levels. We will begin with elementary, and then we will we'll probably roll into the secondary after spring break. But we'll start with the elementary first, of course. Understandably, our youngest students first, and our students who have some special needs. There will be some special populations that will be invited to come into limited in person at the high school level. The secondary, middle, and high. But for now, we'll begin with our littles and our special populations at the elementary level.
Just to add to that, that the phone call that I mentioned that I was on last week, this is a phone call that will now be happening every week with school district leaders and the Oregon Health Authority and Multnomah County Health. I asked this exact question of that group. Is there going to be a metric that would allow us to bring all of our kids back into school and still have mitigating measures, of course, like mask wearing and increased hand sanitizing and things like that. And of course, they didn't offer a date, and I wouldn't expect them to. That would be a political landmine. But that is where the public health officials that were on the line talked about how the strategy is pivoting from controlling a pandemic to living within an endemic. And I am not a public health official. As I shared with that group, I failed high school biology twice, so I'm not an expert on this stuff. Although I felt at times like I have to be. But I'm deferring to the experts on these things, and so that is what they are trying to do, is figure out if there's a way for us to get schools open back up, even if the pandemic is still going on, because as of now, we still don't have a vaccine for kids, and it looks like it might be another year or two before that happens. And so clearly waiting for vaccination of kids isn't going to be the answer. And the CDC has said that they are of the mind that schools need to be the last community service to close and the first to open. So I think the focus of our public health experts is shifting to figure out how we can keep our staff and students safe and control spread in our communities so that schools aren't vectors of transmission even before this pandemic is ended, because it could be quite a while still.
Yeah, we're very confident that when we are able to open, that we will be able to open safely. And I am excited again about the opportunity to bring kids back in a limited fashion and continue to roll that out. It's been a year, and it's time for our students to be back in the buildings where they belong. And we're trying to ensure that we push just hard enough. I happen to sit on the Governor's Return to Learn committee, so East County does have a voice at that table, as well as the executive director's board for the athletics here in Oregon, the high school athletics as well. Again, East County's voice is at the table, and I really do try and push to ensure that we're not ignored and we're receiving the resources that we need. But again, I'll close with a great pride and appreciation in knowing that this community can do hard things. We've proven that time and time again, and during which we'll continue to go as fast as we can, but as slow as we must in order to make this right for our kids and our community.
There was another question put into the chat and that I just wanted to touch on for the whole group. We partner with First Student for transportation services, and we partner with Sodexo for food services. And both of those organizations have done an outstanding job for our community through this entire pandemic. They took a couple of days at the very beginning of it to figure out how to pivot operations completely to an entirely new model, and have been delivering meals to the community, implementing mitigation measures because of the amount of interactions with the community that have occurred to deliver those meals, and then have also established procedures for when we return into our buildings. We have plans in place for how we will still deliver some meals when we go into hybrid, while providing some meals on campus. And then, of course, we have plans for what we can do once we get all of the kids back on campus, if that does become a thing that we can do at some point. And so they've been outstanding partners, and the buses are ready to go. They have enhanced sanitization processes between routes now. The drivers have been trained to do visual screenings of the students as they enter the bus. They've been trained on how to isolate a student if a student does show up at the bus stop with symptoms. We are not legally allowed, and I don't think anybody on our leadership team would want to leave a student at a bus stop if they have symptoms. So our staff from First Student Transportation into the building, we have protocols in place for how to isolate that student on the bus, and then when we get to the school, take them into the care room to be evaluated by the school health professional. And so, yes, I do appreciate you bringing this up. Our transportation team has done an outstanding job, just truly extraordinary. And they've done a great job serving the community in the environment that we're currently in. They've done a great job preparing to serve the community when we can start bringing kids back into the schools.
Mm-hmm.
I just wanted to add, for those that couldn't see the question that was asked, Jordan, that was a great response, but the question that was asked was, a school bus driver, I can say for all of our drivers that we miss our students. When we do go back, will the public be informed of the safety and care that we as drivers are now being trained extensively? That was a great answer, and the short answer to that is yes. We'll make sure that the people
also,
know how
the community share with the community that we are offering vaccines for our educators. That's everyone who works, no matter what their role is in Gresham-Barlow, whether they drive a bus, teach a class, or support learning. They all have an option to be vaccinated, and we have 4 waves of that, and we're just in the middle of wave 2 right now. The center for those vaccines at the convention center. So all of our staff members have, at one point, they make an appointment and they go and have their shot administered. And as they receive that shot, that first shot vaccination, they will receive an appointment for their second and follow-up. So we're, again, just in the middle of wave 2. Of course, the weather over the weekend didn't help us because those vaccinations are happening over the weekends as well.
Fantastic. Thank you so much for sharing that. I don't see any more questions. Again, I'm just going to close that at this time. If you do have questions for either one of these amazing people, please let myself or Angela know. Dr. Perera, Jordan, thank you so much for joining us today. It's a little shorter than normal, but man, you guys really are great at being concise and clear. So keep up the great work, and I'm sure we'll all be thrilled. I wanted to thank our sponsors one more time. Again, the presenting sponsors: Columbia Bank, PGE, Boeing, stakeholder sponsor, Gresham-Barlow School District, and our media sponsor, MetroEast. It takes about 2 to 3 days for these recordings to be available, but if you know anyone that did not get a chance to catch it today because of all the power outages and everything that's going on, know that it will be available on our website by the end of the week. So again, I'll just say thank you to everybody and best wishes. Stay safe, stay healthy. We appreciate you all. Take care.
Thank you.
Thank you, Asha.